Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, March 2nd, giving you the update from Albany Med. All right, Fred, we'll jump into the COVID numbers to start. Here's the first graph, Capital Region, people in the hospital with COVID, currently 134. The high water mark was 353. I want to come back to this graph in just a second, but let's throw up the second one. These are admissions and discharges here to the medical center. We show this one really because I think people kind of visually like to see what's coming in and what's going out.
Right. I think it helps.
And then the third graph here is the morning census here at Albany Medical Center specifically. So we've come under 50. There's 49 in the hospital. There's 36 on the floor. There's 13 in the ICU. And there's 5 on vents. So a couple things, Fred. First of all, of that 49, what's the number that are no longer infectious?
I think today the number, Dennis, was 19.
19.
So it continues to slowly go down.
And then if you go back to the first graph, and then if you look at this graph, it was pointed out to me by a couple people, Fred, that while we were on a steep decline for a while, the last couple days, there may be a plateauing. Now, I'm going to say it's far too early to draw any conclusions.
Yes.
But we're watching that.
We are watching that, Dennis. And nationally, if you look at the national data, it also appears that we're plateauing a little bit in terms of new cases as well as hospitalized individuals.
All right.
So we'll see.
We'll see on Thursday.
We'll see on Thursday.
In the category of more good news, if you look at the people in the capital region who are being tested and who are positive, and they do a 7-day rolling average, Fred, we've come under 2%.
That's right, 1.9%.
1.9%. Now, if you'll recall back on January 7th, that was as high as, I think, 10.2%.
That's right, Dennis.
So that's coming down. Now, Fred, as hospital director, you have said, and the team has been charged with coming up with some operational changes that we might be able to put into place when we come under 2%. So we're now talking about those things.
That's right, Dennis. So there were a number of things that we did as the rate of infections went up to try to protect our patients. And one of them was changing visitation.
Right.
So as you know, we actually dramatically reduced the visitation here on the campus for our patients. Now that we're below 2%, we're going to change that up. And we've been in conversation literally now 2 weeks with other hospitals in the region because we want to kind of do this as a sort of a unified approach so as not to confuse people. But frankly, we're all looking at the same numbers, and so we ought to be making the same decision. So on Monday, St. Peter's Hospital, Samaritan Hospital in Troy, Ellis Hospital in Schenectady, and the Medical Center are going to change their visitation, going to start to allow visitors to come back on their campuses.
Excellent.
Now there's a caveat. That's assuming that there's no jump up in cases, which we don't expect to be the case. Here at the Medical Center, what that means is we're going to have 2 2-hour blocks.
Okay.
So you recall back in the fall, we just had a 4-hour block. Now we're going to break it up a little bit, which I think is going to be better for visitors and patients.
Yes.
So 10 in the morning till noon. So that'll allow some visitors to come in when the doctors are roundings for better communication. And then 6 to 8 p.m. in the evening, which will allow visitors who are working during the day to come in. So one visitor at a time. It could be a different person in each of those 2-hour blocks. And we're going to ask visitors to screen, so temperature screening as we've done in the past.
Yes.
And we're also going to ask them to wear one of our masks.
Right.
Lots of people out in the community are wearing cloth masks. We think that the surgical masks are a little bit better, so we'll be giving them surgical masks if they don't have one to wear.
So if they come in from the outside and they're not wearing a surgical mask, we'll provide one for them.
Correct.
Okay. And Fred, this will be people who are going to visit people in the hospital, anybody in the hospital, not just people in certain criteria?
That's correct.
Okay,
that's
very good.
Correct.
All right.
And Dennis, there are other exceptions. So there are exceptions for children, 2 parents, laboring moms, amount of time that
and end of life,
labor partner, and end of life.
All right, very good. All right, Fred, thank you for covering those things. By the way, you mentioned doing symptom monitoring and temperature checks on visitors when they came in. Are we going to continue to do temperature checking on our own employees?
So Dennis, that's another thing we're going to change. We're going to stop doing temperature checking on our employees, but we're going to expect that our employees, as part of their professional approach to their job here at the medical center, that they will screen themselves not only for fever but
Right.
for other symptoms and not work when they're sick. Very important.
We've talked about this many times, the supreme importance of being sure that you do not show up to work ill
Correct.
under any circumstances. So we are definitely going to continue to hold the line on that. Fred, let's talk about vaccine efforts, specifically in the Capital Region. There's some good news there. If you go out to capitalregionvax.org, again, I encourage you to go out there. I think now we've had either close to or over 500,000 visits to that incredible website. You can link onto the vaccine tracker and you can get the most accurate and up-to-date data. In the Capital Region, 188,000 people have received at least the first dose of vaccine, which is remarkable.
Incredible.
107,000 individuals have completed the series, and that's a significant percentage of our workforce.
Of the community. It's almost 10%.
It's almost
Dennis.
10%.
Almost 10% of our population here in the Capital Region has been fully vaccinated.
Fully
Just
vaccinated.
incredible.
And Fred, we heard today that of the workforce, so you're right, it's 9.9% of the Capital Region. Our workforce is over 90% fully vaccinated.
That's right.
And we heard, and now it's been a couple days since we had anybody test positive at
3
all.
days, no positive employees.
Very good, very good.
Tremendous.
We also know that last week, 1275 Broadway finished up the incredible work that they were doing down there. We heard some data today about how many people they vaccinated down there.
So they have administered over 19,000 doses and fully vaccinated about 9,500 people.
Incredible.
Really quite impressive.
So too many people to name. I know we've talked about them in the past, but those efforts certainly have saved lives. So thank you to all those people.
And Dennis, there's going to be another mass vaccination site opening up, right?
There is. So tomorrow, the FEMA site, the federally run site on Washington Avenue at the Washington Avenue Armory, will be open for business. And they're expected to do thousands of vaccines a day. I'm sure you've heard about this in the media. If not, please go to the website, capitalregionvax.org. The eligible people are 1A and 1B by certain zip codes.
That's right.
So if you're eligible, you can pre-register, and all the information to do that is on that site. But Fred, if that wasn't exciting enough, that we now have vaccination areas in all counties, and the University at Albany, and Washington Avenue Armory, we had some incredible news last Friday in the vaccine area as well.
That's right, Dennis. So on Friday, the special panel that the FDA put together to review the J&J vaccine recommended approval. And over the weekend, the FDA actually approved for emergency use the J&J vaccine, which is a single shot, very efficacious, very effective vaccine that I think is starting to get distributed today or tomorrow around the country.
It is. They're rolling it out. And Fred, if I read the data correctly, it is 100% effective at serious death and hospitalizations.
That's
is that
right.
correct?
In the vaccinated population,
In the vaccine.
there were no deaths and no hospitalizations.
Right. So I should say serious illness and death.
Right.
So that's remarkable news. Fred, it does not require the deep cold storage that Pfizer does.
Can be stored in a refrigerator at refrigerator temperatures, but once a vial's open, it has to be used within 6 hours.
But obviously being single dose and the fact that it does not require the deep freeze is really a game changer, because it means that at some point we expect this to be pushed out to, for example, physician offices the way traditional vaccines have
That's
been.
right. That's right. It's going to be perfect for that.
So we expect that we'll be getting some of that on this campus in the next week or two as well. Fred, changing topics, last topic, although it is related to COVID, I think it leads to a broader conversation. I know that you and I and many others on this campus for a long time have been focused on the importance of reducing length of stay.
Yes.
That was one of the things that from the very beginning that you were always leading the charge on. And I think you want to share some data about our current activities related to length of stay.
That's right, Dennis. So length of stay is important for a whole host of reasons. I know you know, but our viewers should know as well. Having people not be in the hospital any longer than they have to be is in their best interests. For a lot of folks, the hospital is disorienting, particularly our elderly.
Right.
So being at home is much better. Those patients who need to be in a different setting, let's say rehab or a skilled nursing facility, the sooner they get there, the quicker they move down the path of recovery. So it's very important that we try to provide all the needed care in as short a period of time here in the hospital as we can. Being able to do that also helps with the flow in the hospital and our ability to meet the needs of the community. If we can reduce length of stay by 10%, that means in this physical facility with the current staff,
Yes.
we can take care of 10% more people.
Which is a significant number.
It's really important,
Right.
particularly if you think about things like COVID and surges.
Right.
So length of stay is important for a lot of different reasons. So let me show you a graph. This is length of stay, a 7-day rolling average, starting in January of 2020 through last week.
Right.
And you can see that somewhere around August, September, we started to see a very significant increase in length of stay. It's gone up a day.
Right.
I think a little over a day.
Right.
So that's multifactorial.
No question.
The second slide, let's put up that graphic, splits it out. So the dotted line is the same as the first graph we showed you, which is the total population length of stay for patients here discharged from the medical center. The solid line are those patients who didn't have COVID.
Okay.
So what you can see is that COVID did considerably increase the length of stay, but there's also been a growth in length of stay for the non-COVID patients. And there are a host of reasons
Sure.
related that cause that. We really need to refocus on our initiatives around length of stay and really try to bring that solid line down back to something more normative. We were in the 5.5 day
Yes.
length of stay. That's where we need to go, and frankly, even below that if we can, providing good, high-quality care.
For all the reasons you described, quality, patient flow, being good stewards of the resources we have on this campus.
Absolutely. All of those are the reasons for doing it. So I think we're going to talk about this periodically.
Yes.
We're going to try to raise the consciousness of all of our staff around this again.
Right.
And really try to get back to and even improve upon where we were before COVID hit us.
Excellent, Fred. Thank you. Great graphs, and like you said, we'll talk about it again soon.
And once again, those graphs, thanks to the analytics folks.
Yes.
Thank you very much.
You asked for it, and they produce it every time.
Absolutely.
Right.
They're tremendous.
All right, so we'll be back again on Thursday. We'll have some good updates then on how things are going at the vaccine site on the Washington Avenue Armory. We'll have a better sense as to what the numbers are here on this campus, and I'm sure we'll have some other good news as well.
That's right.
All right, very good. That's it. We'll be back again on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.